ఫొటోస్ తీసుకో తన దగ్గర నుంచి.
Hey, the first slide is serous cystadenoma. This is from the ovary. It's a benign cystic lesion in the ovary. And how do you recognize or how do you identify cyst in the ovary? How do you label them? Okay. Cystic lesions are usually labeled according to their epithelial lining. Okay. So if the epithelia recapitulates, this epithelia recapitulates the lining of your fallopian tube. So it is known as serous cystadenoma. Adenoma because it is arising from the glands. Now, if this lining recapitulates the lining of the cervical or endocervical epithelium, then it becomes mucinous cystadenoma. You have to know how to identify them. I think you have browsed them up in your histology. Sometimes you see squamous epithelium. These are usually noted in mature teratoma or dermoid cyst of the ovary. So that is just a brief overview. Now, to know if it is benign or malignant, you have to know the features of a normal epithelia and an abnormal one at the cellular level and at the tissue level. Okay. At the level of the cells, malignant cells are usually have enlargement of your nucleus. So nuclear changes, enlargement, hyperchromasia, presence of an active RNA focus in the nucleus, your so-called nucleoli. Okay. Pleomorphism, those are the cellular or the nuclear changes that you have to note in malignancy. If these are not present, then it's safe for you to say you are looking at a benign lesion. Okay. At the tissue level, stratification may be an evidence of malignancy, especially if it is at the extreme, okay, like more than 4-5 layers of cells. And of course, you can call it pathognomonic sign of malignancy is of course evidence of invasion. Okay? When the cells have already breached the basement membrane and begins to infiltrate into the stroma, or there is already evidence of a distant metastasis due to hematogenous spread. Okay, so that's an overview of your neoplasia. How do you term your growths, new growths? What are the suffixes that you use? For example, in a benign epithelial lesion, this is serous cystadenoma. The malignant counterpart will be serous adenocarcinoma. Okay, so epithelial. For your stromal or mesenchymal lesions, your so-called sarcoma, okay, malignant. For lymphoid lesions and hematogenous malignancies, they have a different terminology, okay? Like leukemia, lymphoma. Okay. So this is your serous cystadenoma. You identify the cyst, or you label the cyst according to the lining epithelium. What does it recapitulates?